My name is Bea Rector, and I'm the Director of Home and Community Services Division in the state of Washington. And I want to share with you a model for policy change that can be implemented by a state or even at a local level, for example, by an area agency on aging. So, our mission here at the Department of Social and Health Services is to transform the lives of older adults and individuals with disabilities by promoting choice, independence, and safety. And to do that well, we know that we have to innovate how we work and support family caregivers. So there are more than 850,000 unpaid family caregivers in Washington state, and only a very small fraction of these caregivers are funded in the public system. And that's true for their care receivers as well. Unpaid family caregivers are the backbone of the long term care system. We also know that there's a high economic value to the state and the federal government for the services that are provided by unpaid family caregivers. The care they provide in Washington is estimated at a value of $10.6 million a year, which is 5 times what we spend in our Medicaid program for long term services and supports. We know that if 1/5 or 20% of unpaid family caregivers were to stop providing care, it would at least double the cost of what we're spending in Washington on long term services and supports. And we know that we're already spending 6% of our general fund state. So we know that expanding services to support unpaid family caregivers is a win-win for us. It helps older adults and individuals with disabilities remain at home, and it helps family caregivers reduce the burden and stress of caregiving, and it's also cost effective. One of the things that we also know is it's a challenge to try to find and serve unpaid family caregivers because they don't recognize themselves as caregivers. They see themselves as a daughter, a son, a spouse, a neighbor, simply helping out their loved one with daily tasks such as shopping or taking them to the doctor or even helping them dress and toilet. We have found that outreach and engagement of family caregivers is important because they typically do not reach out for help, and they are under oftentimes significant levels of stress and burnout. And it may be too late when we find them to wrap services around them. So, supporting individuals to be able to stay in their own homes when they need assistance with activities of daily living makes sense from a person centered approach. When asked, it is where most people want to live and age because it's where they feel most comfortable, where they can maintain autonomy and control. From an economic perspective, assisting individuals to stay at home is also more cost effective on average than supporting them in a facility with 24/7 staffing. Creating options that support individuals in their choice to remain at home requires finding ways to support unpaid family caregivers, both paid and unpaid. Again, caregivers continue to play a pivotal role for their family members who need help in order to remain at home. This chart here just simply shows you the state support of unpaid family caregivers in Washington and how that's evolved over time. I think it's important that states and advocates know that the work of supporting family caregivers is intentional. It requires effort over time, and each state or organization needs to start their journey wherever they happen to be, and that every state has work that they can do to improve in this arena. It's common for our legislature in Washington to fund pilots. They ask us to implement pilots. They want us to evaluate those pilots in order to determine the impact on the cost benefit analysis or return on investment, as well as the difference the intervention makes from the perspective of the caregiver being served. So the slide that we're on right now is really just an example of the type of strategies and funding sources and policies that Washington uses that are necessary to support the diverse needs of caregivers. In the interest of time, I don't plan to review this slide in great detail, but include it to give you a sense of the types of funding, again, the policies, the laws that we utilize in Washington. Many of these fund sources, like the Older Americans Act and Medicaid, are available for use in most states. In 2007, our state legislature mandated development of an evidence-based caregiver assessment and referral tool. They had made a number of increased investments in our state-funded programs, and they wanted to better understand the impact of those investments on the caregiver. They wanted to know the difference that the services they were funding were making. The assessment is called TCare, or tailored care, and it utilizes an evidence-based assessment process which helps to understand how caregivers are feeling about their role in their journey. It identifies things like depression and the types and levels of burden, in addition to uplifts that are associated with each individual caregiver. It helps the caregiver select goals and strategies, and it also recommends services for supporting the caregiver where they are at in their journey. We use it to consult with the caregiver on their informed choice about the next steps that they see would be most helpful to them. We create care plans that are caregiver centric, that they choose and want to embrace and follow. And then we do follow up with the caregiver, because caregiving is a dynamic process of change, and what works for somebody today may need to change in the future in order to work with them. In Washington, the services available to support unpaid family caregivers are tailored to what is needed to keep individuals in their own home and to keep the caregivers well. What we have learned over many years is that caregiving supports make a difference in improving the ability of caregivers to maintain their role and also improve their own health. These services are provided under a variety of fund sources, including the Older Americans Act, general fund state money, and Medicaid. And the services available to caregivers are informed through that evidence-based assessment that I talked about. Services range from things like caregiver assistance services, which would be things like respite, housework, and errands, training and education to help caregivers gain skills and knowledge to care for the recipient. Things like support groups are also in that category. Specialized medical equipment and supplies needed by the care receiver, but also make sure that the caregiver does not get injured as they're providing care. And then health maintenance and therapies are clinical or therapeutic services for caregivers to remain in their role and address their own health and wellness. Examples of these services would be things like massage and acupuncture and evidence-based exercise programs. So as I've said previously, supporting unpaid family caregivers makes sense economically because it's less expensive than more formal settings of care, such as paid personal care in the home or in residential settings or nursing homes. As you can see from this chart, average monthly spending in our family caregiver support program is projected to be about $800 a month, which is significantly less than the monthly average of spending in other settings. Another way of saying this would be that we can support 3 to 6 unpaid family caregivers for the same monthly cost of serving just one person in our Medicaid-funded long-term services and supports programs. We have also looked at whether offering assessment and services to unpaid family caregivers means that people they are providing care to stay home longer and can be diverted or delayed from entering the more formal, expensive Medicaid personal care programs. And what this slide shows is the answer is yes. Offering services resulted in a 20% reduction in the entry of care receivers into our traditional long-term care programs. And this means that the program, even when funded through general fund state dollars, can pay for itself over about a 3-year period by reducing the growth of who is served in Medicaid. Washington has also participated in a study with other states to understand the difference in outcomes using TCare, our assessment tool, compared to our previous approach where we did not have a standardized framework to work with caregivers around. What we learned is that 84% of the caregivers showed improved outcomes in the 6-month period following the first use of that tailored assessment. There were statistically significant improvements in a number of burdens, as well as decreased depression, a greater level of comfort in their caregiving role, And for spousal caregivers, there was also a decrease in their intention to place a loved one outside of the home. Again, the evaluation of supporting unpaid family caregivers showed that the quality of life of the caregivers improved through these interventions. We also know from using this model that tailored care of screening, assessing, and consulting in a caregiver-centric way, that what we're hearing from our caregivers is that it was the first time that anyone had talked to them about how they were doing or had talked to them about the importance of self-care. Many of their conversations with medical professionals or social services providers outside of this TCare family caregiver experience was really about their loved one and not about them. We know that caregivers are often torn between caring for their own needs and caring for their loved ones. So in our evaluation, 4 out of 5 caregivers reported that the program and the approach that we're using here in Washington State help them to understand the importance of taking care of not just their loved one, but also their own health and well-being. So I just want to reiterate before queuing up questions that you may have for me, that supporting unpaid family caregivers is critical to helping individuals with disabilities and older adults remain in their own homes and in their communities. It's also key for supporting the health and well-being of the caregiver, as well as the person to whom they are providing services. So with that, I believe we do have time for a couple of questions, and I'll throw it back to Ashley to facilitate that.
Yes, thank you so much, Bea. Bea and I go way back, way, way, way back. If you don't know, we have a podcast called Advocates in Action, and Bea was one of our amazing guests this season. And I just dropped the link for that in the chat where you can learn more about the work that she does in her team. And I see that some amazing questions are coming in, and we only have until 2:30, so we'll jump into those now. So I know that Nancy put a question in here asking you, B, do you know if there's current reimbursement in Massachusetts? Because she has helped a lot of seniors over this last year gain access to COVID vaccines when they didn't have technology to do so on their own.
Yeah, so I'm assuming the question, Nancy, is really around these kinds of family caregiver supports. And what I would say is the Older Americans Act is a national program. Every state operates it. And one of the titles under the Older Americans Act, which is 3E, is a national family caregiver support program. So there's certainly not enough funding in the Older Americans Act to support all family caregivers, but every state does have a program, typically operated through their area agencies on aging, that supports family caregivers. So the best thing to do would be to connect with your local area agency on aging so they can refer you to available services.
Awesome. And the next one is from Melissa. Do Washington residents know that these benefits are available? Is there a process in place where healthcare providers share this information with the caregiver recipients' families?
Those are great questions. What I would say, and I said that at the beginning of my presentation, family caregivers often do not see themselves as caregivers. So it is a difficult group to market to. We do a lot of marketing in Washington State, trying to help caregivers understand that the work they do is important, it's valued, and it's okay to ask for help. And so, yes, we do a lot of marketing. And what we also know when we ask family caregivers is the place they would go to ask for help is their primary care physician. So part of what we've done is do a lot of outreach to physician associations and through our Medicaid state agencies to get those words out to the primary care docs.
Perfect. And then Christine Wilson asked, why is it so important to generate this data to support funding for a range of caregiving resources?
I think it's vitally important to be able to tell the story about cost benefit analysis and outcomes for caregivers because there are a lot of competing priorities for dollars. That's true at the national level, it's true at the state and the local level as well. And the folks that make those policy and appropriation decisions really want to know that their money is being well used and they want to know it's making a difference. So, by gathering these kinds of data and sharing the outcomes, both in terms of health, but also in terms of return on investment, I think makes it an easier sell with legislators or congressional members around making the significant investment that needs to be made to support caregivers in caring for their loved ones.
Yes. And as a plug for the podcast, the title of your episode is You Call It dot dot dot, We Call It Caregiving. And I know you mentioned multiple times how people don't identify as caregivers all the time. So can you share a little bit about the creative ways that you all have marketed this and made these resources available?
Yeah, absolutely. So, I mean, in addition to kind of the traditional print advertisements in senior newsletters or local newspapers, radio ads, we've got some ads on the side of transit buses in some of our metropolitan areas. Pre COVID, we had some advertisements going on actually in the movie theater while you're waiting for the movie to start. And a lot of it is word of mouth. You know, if you talk to a family caregiver, oftentimes they know 3 or 5 other family caregivers that they're aware of. So if you start making sure that caregivers are aware, they will be your best advertisers of the service.
Yes. And I also know another plug for this amazing podcast that I host and Bea was a guest on, that you shared a lot of resources for people on this call who aren't in Washington State. Where can they go to find out, what the resources are in their local areas?
Yeah, I think the area agencies on aging, which are a national network, you've got one in every state and every local area. They're the best resource, particularly if the person you're caring for is age 60 and older. Also, some of the national or state associations, like the Alzheimer's Association, the Multiple Sclerosis Association, oftentimes those entities are really familiar with the available services in their local area, both for the people that you're caring for as well as the caregivers themselves.
Perfect. And with that, Bea, I would just like to say thank you so much for your presentation and for being here. Like I said a million times, please go listen to Bea's podcast because on the link where we highlight Bea, we also have a number of those resources that she just mentioned. And then also her contact information for her organization if you would like to reach out directly. So thank you so much, Bea.
Thank you, Ashley. Appreciate the opportunity.